Hi everyone, this time I will show you a small part of the basic Russian lips technique. Before starting the procedure, I remove the numbing cream, clean the patient's lips, disinfect them and check if I can detect a supralabial artery. Sometimes it is very superficial and visible. By following it, I can understand how my work will be performed, and I warn the patient that due to this, more bruising may appear. I will show this pulsating artery later in one of my posts. I always tell the patient's chin to better performance of the procedure. I also ask the patient to open the mouth slightly to maintain evenness of the wet-dry border during the procedure. The client here has the second procedure as she had very thin and difficult virgin lips. I use deep density dermal filler. I start with the first entry point of the top lift Cupid's bow. This entry point is 2 mm lower vermilion border. I start using fanning while pressing on the dosage on the way back. I stretch the lip back towards the nose to get a good lip shape and sharp Cupid's bow as well. When I go down to the lip with the needle, I can slightly touch the wet-dry lip border and go back while pushing on the dosage. It also depends if lips are very difficult and need to gain some volume, because really, where do you get it if your lips are very narrow? I also pay attention to where the artery is localized if visible. The number of the strokes I do depends on every situation. If I need to go back into tissue, I always go back through the same entry point to make my patient comfortable. Believe me, patients won't feel any discomfort rather making extra entry points. The next entry point, I go 3 to 5 mm lower than the first entry point. The closer the commissurus of the lip, the lower injection point from the red edge of the lip border. When I start the lower lip, I make the first entry point in the middle of the lip. From the same entry point, I work on the both lip sides with little strokes. Then I make entry point on both lower lip sides, 5 mm apart from the central one. If I need more filler in the lip, I can combine different techniques. After that, I will clean my patient's lip and surrounding area, because we always want that our patient will look good in the pictures. Look at those beauties, look at them. Thank you for watching. If you want more, please share and like. Thank you.